This is WZRD Chicago 88.3 FM. And we have with us at WZRD Violette Kolcan. She is a holistic medicine practitioner, clinician. She is with us here at WZRD. Welcome, Violette. How are you?
Hi, Trudy. Welcome, everybody, our audience. And it will be a pleasure to talk about the holistic medicine and how to get the happiness and happy, healthy life.
Okay, Violet. I'll call you Violet, but us wizards or DJs, we try to remain anonymous while we are on the air. But first of all, you mixed. You studied Western medicine, right? You practiced Western medicine in the beginning?
Yes, I combined the Western and Eastern medicine. That is my life. My first specialization after a medical school was obstetrician gynecology. So I practiced for 12 years. And then I was introduced to holistic medicine, acupuncture, and I did PhD in Oriental medicine. And that's what I'm serving to my patient, both. And nowadays, the functional medicine, holistic medicine, reach like the highest level of people interest. Everybody would like to naturally to heal. So everything we are, what we eat, how we think, positive outlook, that you have the positive outcome. So I focus on female and male health, longevity, and also fertility, sport, injury, car accident, worst comes. So I helping people to prevent to have any diseases and also help them to live healthy with healthy habits on daily basis.
Well, first you were practicing Western medicine, but what happened? Why did you? If you had been interested in holistic medicine in the beginning, that would have been what you would have studied first. But what was it that got you interested in to spend the time and the money to get into the holistic side of medicine?
That's a good question, Trudy. And you are absolutely right. If I was first interested in natural medicine, I will be not interested in study pharmacology and all chemical input in your body. But very interesting story. I coming from the family that my own both side grandparents, especially grandmothers, they were involved in natural medicine. So for me, it was really not like a medicine because they doing cupping therapy. My both grandparents, they were herbologists, so they know everything about the medicinal benefits of the medicinal plants. And they have a big plantation, and they, when all farmers, they have grow the corn, the potato, vegetables. So they were very innovative, like 50 years ago, and they have like rosemary field, lemon balm, and they produce the extract from elderberry for immune system. And as a little child, 5-year-old, I didn't treat as a medicine. For me, it was like a daily style life. When I was sick, we never go to the doctor. They did the cupping, and they have, all this herbal mixture. And for me, it was like growing at that way. And I would like to increase my knowledge, what I already know, being in this family, that I decided to go to medical field and be MD, medical doctor. And I was like excited of the last years of medical school, of newborn babies and coming to the world, make people happy, especially I have a good successes in infertility. All IVs and everything what I was doing so that was very interesting. And then I was study gynecological laparoscopy with Northwestern University. And at that time, I have my own problem with my lower back, and then I would like to have the help different way. So the acupuncture helped me, and with my migraine, so as well. And I decided that is what I want to do. So I was study, and now, after graduation and licensing, so I can help people also in natural way. And nowadays, all MD is doing like a second specialization, functional medicine, because really in medical school, there is not so much about the herbal medicine. And like my friends, pharmacists, pharmacy doctor, they have more about the herbal medicine than we as a doctor. And also like diet, nutrition is very just a few hours in all medical school. So it's a little a shame, and I think that all medical industry should change, and we have to go to the roots to the problem and find the roots of the problem, which very often is in our daily routine, our wrong diet. So that's why I went back to school, and I'm just happy having my knowledge and experience in Western medicine and also in holistic medicine. I'm very spiritual. I also made courses from Reiki. I believe strong in energy healing. So not only I am a doctor, I'm also the healer, and that's what the first my patient telling me. This is the power, what you're doing. And even by talk and the way how you approach people and let them go the right direction. Very often I am a mentor. Many stuff sometimes coming from daily poisoning and daily being in a wrong environment, very high demand work job, very high demand life partner, and people instead cut off this poison in our life and go forward with happy life. They dealing because sometimes they afraid of the changes in their life, even for good, but they have this mechanism how to deal with the bad situation, and they dealing at least is familiar. But sometimes you need some encouragement. The people encourage you, and you can choose and make the right choices. So I'm happy that I'm influencer and help people also to help them to make their own right choices.
Well, when you holistic medicine is, the way I understand it is it incorporates the whole body. So when you were talking about yourself and your hip back problems and migraine problems, were they connected in some way? Did you finally find out that they were connected? If you used acupuncture, did your doctor tell you at all? Were they connected?
So this is a very good question. Thank you for asking, Trudy. So all body is like a one organism, and all organs are connected. And as a being gynecologist, as a first, so I know very well embryology. So we have first when the embryo is created, so we have three specialties like ecto, endoderm, mesoderm. So like you doing from the ectoderm, there's like skin coming and also nervous system, and they separate, one going on the surface, one going deep. That's why sometimes people asking how is the acupuncture working, and you stick the thin acupuncture needle like a floss, like a hair sterile needle, which stimulate the end of receptors, and there is the connection you put through the skin on a certain level to the muscle layer with receptors connection. And and that stimulate ascending way the nervous system with the information going to the brain transform and stimulate body to produce if there is like, for example, like inflammation in a joint or muscle strain. So it stimulates body to produce anti-inflammatory substances. Also serotonin, endorphin, dopamine. So it helps also very well with your body problem, like a mental problem, spiritual problem. So it increase and help those neuromediators, and it helps in your like depression, swinging mood. If you have ADHD, that helps you with the focus. After muscle sprain and injuries, when you place the needle in the area, so there are local points and also distal points. So it helps stimulate body to produce collagen. After 30, 35, we don't produce any more collagen and also hyaluronic acid. So that's why we aging. We have 5 types of collagen in the skin, in a deeper layer, muscle layer, and joint, ligaments, tendons. So we see our appearance or aging on the skin. You look at your face to the mirror every single day. So you see you aging, the skin drooping, it's not firm anymore. But the same happening in your body. The collagen is your body, also in your eyeball, also in your organs, like your liver is suspended on the ligaments, also like female uterus is suspended on the uterus and is suspended to your pelvis. So that's why women with the age can have like a uterus prolapse, yes, because there is the collagen which holding up the uterus, and then urine incontinence that's coming with this. So everything it is about the collagen, hyaluronic acid, and with the acupuncture needle stimulate body to production. You can do also like cosmetic acupuncture on the face, so that way you can have better face and a natural way, non-invasive facelift. So everything is connected. So when you come to the doctor saying there is the ringing in the ear, is not necessarily the problem only in the inner ear, and can be damaged in a auditory, vestibular, cranial nerve, but also can be a problem with your kidney. So certain organs are related to certain our senses. So, and also emotion, and if you have some asthma attack and you have some bronchitis and chronic bronchitis, and many people going through life trauma and they going through some grief. So for example, grief is related to your lungs problem and can develop more your lungs diseases. The same with liver. Liver is related to anger, and many people living a whole life in anger, they predispose more to have the liver problem or a liver bile stagnation. You know, when you are angry and all the time holding this tension, so everything tied up, your bile duct tied up, and the bile going slow and sedimenting and create the livers, gallbladder stones. Or, for example, blood clotting, the same. So it's sedimentation and cholesterol deposits, and that's how that starts. And TIA, transient ischemic attack, when it's like also blood clotting, but can be like blood clotting, narrowing the blood vessel, but also blood clotting like a flipping, yes? So one side is like opening and closing. So it's attached to the wall with one side and the other like moving. So sometimes you have like older grandma, and sometimes she's so have a big clarity of her mind, and sometimes it's just like very off and don't remember stuff, and then suddenly, you know, clarity. So it can be also TIA, which is hard to find out. You have to have scintigraphy, have a special contrast to the blood, and sometimes people and then you have the all pictures of scintigraphy, and then you see, because that isotope which connect with the flipping blood clot, you can and you can see it. But sometimes people saying that are overweight, obese, and they say, I have wonderful cholesterol, is good, and I don't have to do anything, and they just ignore it. The laboratory screening is good. So holistic medicine, functional medicine, and also I have very good professor mentors in medical school, so they saying, if you have some test results and it looks good, but patient and symptoms that are not good, so remember, don't treat laboratory screening, treat the patient, okay? Don't leave him alone. So he has some symptoms, so you have to take care of the patient. And opposite, sometimes laboratory screening can be wrong and the patient is just perfect, but you maybe do another laboratory screening. The laboratory screening doing also, we humans making mistakes. So
that's why it's so important for a second opinion, right? Because we always hear it's so important for a second opinion.
Yes, so do again, because, somebody put the label wrong, your technician or something, not always you have fully trust everybody. It's better to make a double, triple checkup and be sure that you're doing right diagnosis, that you're doing right treatment plan strategy, so that you can help the people. So everything is connected. So if somebody have a problem, if the eye and bad vision and blurry vision, or sometimes can be not related only to the eye, can be also to the blood vessel in the brain, can be also related, like eye vision and ear can be related to your kidney changes, and so everything is related. So that's why we're looking holistically to the body, the all Oriental medicine doctors.
Well, for me, I've been nearsighted ever since I was very young, like about maybe 5 years old. I don't think there's anything in acupuncture or holistic medicine that could help me restore 20/20, but is there anything that would be able to help me have better vision than what I have now?
There is also like a special optical devices you can put on the eye, and that you look through these little holes, and the focus is better and strengthening your eye. And there are also acupuncture points for that, and those special glasses training your eye, and all eye vision and everything what's happening in the eye. So there is like a multiply reaction in light going through the eyeball. So there is also iris. There is accommodation of the little muscle in the eye. There is also iris, and until the light and the vision sit on the back of the eyeball on the retina, so can be like macular degeneration. There is so many stuff involved. Eye is like a small organ, but it's so interesting how it works, and many way we can help. And diet too. Diet is very important, like vitamin A. And nowadays, I remember when I was a child, my grandma always like giving us the butter every day, vitamin D, and also vitamin A. And nowadays, when we just have this, all diets shifting, depends what is new discovered. And so we have low fat diet, low carbs diet, and we have the Atkins diet, and we have proteins diet. What is good? And what is good for your neighbor and your friend is not always good for you. So that's why we individually in my office, I schedule the diet, and what is good depends on the body symptoms, laboratory screening, our interview, genetics too. So then if somebody is skinny, it doesn't mean you are super healthy, and you can have very high cholesterol, genetically very high. So everything is very individual. There are general answers to the question, but I individualize all this herbal formula, treatment strategy plan, and so every doctor should do this, like very individual, because there are cases and symptoms, and there are very rare diseases, and 90% going this way and 10% this way, but you always giving hope to the patient, even like cancer patients. So there is always hope. There is always special treatment plan. There is always diet. Nowadays, everybody pay attention on diet, nutrition, what we eat, the supplementation. So they are very important part of our daily routine.
When you spoke earlier about your grandparents and them having a farm that did they specifically grow these herbal plants to sell for medicine, or were they just growing and they had like a plot set aside for the family's use?
Both. So they have a contract with the parapharmaceutical company, and they growing on this manufacturer level and the good quality organic to have the good sources, and they really did like for manufacturer level to produce the supplements, the natural vitamin, not synthetic, because you can take vitamin B group, natural vitamins, but you can take also synthetic. So this is important what you're taking, what chemical form of many vitamins. So that's what they focus, natural way healing.
Yeah, in Western medicine, it seems as if it's mostly reactive. Let's look back at your grandparents, because they instilled this openness in you to embrace holistic medicine. What about herbal medicine? Is that reactive, or is there herbal medicine that is proactive, keep you healthy so you don't get sick?
Yes, absolutely. So, I'm myself not 20-year-old anymore, and I know the body changing, especially women go through menopause. Some women going with a very difficult time and have hot flashes and other symptoms for 15 years. Some women 1 year, some women 6 months, some women going very quickly. And always ask your mom and grandma how they usually went through that phase of your life, and usually very often you have the same. And you have to help the woman with the diet, because according Chinese medicine and Oriental medicine, there are herbs and nutrition and the food, what you take to your body, which is cold energy and hot energy. So if I had once the lady, she was through menopause, terrible hot flashes, sweating to the point at nighttime you have to change your old clothes. And she telling me she taking ginger, turmeric, jalapeno, habanero, 5 times a day, the extract, and I live healthy. Okay, there are healthy stuff, but not in your case to the point that she had all this on the face changing eruption and acne, like menopausal acne, and that was like very terrible to fix. And I told her, first of all, you stop it, and then you cannot add the heat to the heat. Inflammation is the heat. One of the sign of inflammation is heat. So don't put heat to the heat. So she stopped it, and there are other like a cold energy like cucumber, watermelon, but there are also like you have IBS, irritable bowel syndrome, when you have constantly like running diarrhea. So those people, for example, they have a lot of cold energy in their intestine. So you cannot put cold. So you cannot give them watermelon, you cannot give them cucumber, you cannot give ice, room temperature, because that increase the symptoms. So there is very important energy of our food, of the herbs. The same like for women, we can prevent. You ask about the prevention. So you can prevent, and a few years before menopause, you can start taking some supplement like black cohosh, danquay, which put you smoothly through the menopause. Especially, your mom didn't go, your grandma didn't go so well. And then you have like a smooth transition, because like premenopause first, because we have two group of the hormones for female, progesterone and estrogen. And first in premenopausal, progesterone going down, so you don't have yet hot flashes. Progesterone is responsible for the quality of our menstrual cycles, so you have not regular, you have like irregular bleeding, heavy, low, or coming, appear, disappear. So this is the beginning, this premenopausal progesterone going down. And then the second phase is when the progesterone and estrogen going down. When estrogen going down, then you have that all these terrible hot flashes. So
is there any since the body that has the woman's body goes through the hot flashes, is there a purpose? Is it the body becoming damaged and having a hot because it's aging, or is there a purpose? Is there what is the body trying to do with those hot flashes?
So we have like sympathetic and parasympathetic nervous system, and our female hormones that are released in ovaries. There is also hormones which are which stimulate those ovaries, like lutein hormone, and there is FSH, follicle stimulating hormones. Or those hormones are produced like by pituitary gland, which is located like in a brain, just between the eye and behind. And pituitary. So there are many glands in which are regulate our day-night behavior and temperature behavior. There is thalamus and hypothalamus.
Yeah. Day and night, the circadian rhythms, is that the day and night regulation of the body? Like this?
That's why women have more hot flashes in the nighttime.
Oh.
And that's why when we have a pineal gland also, and with the age we have less melatonin, and people have problem with sleeping. They retired, and now they have plenty time to sleep, and this is like paradox. They cannot sleep. So that's why naturally people taking melatonin, like supplements with melatonin, help them sleep. Like my grandparents, when they grow a lemon balm drinking lemon balm tea before nighttime, also calm your body. And
does lemon balm contain melatonin?
Lemon balm has like calming properties for nervous system, and if you have really deep problem with the sleeping, you have to take separately just only melatonin, because like lemon balm has everything and other ingredients, so not only the one ingredients. But if you have a really big problem, then melatonin you taking separately. The same like people taking multivitamin. So when you have multivitamin, there are small doses of vitamin B group, folic acid, vitamin E, vitamin A, small doses, and the minerals like daily routine. So it's like preventive. But if you have like cramps in your legs and you start having symptoms, which is the symptom of low magnesium, potassium, then you're taking not only like 40 milligram of magnesium, then you have just separate magnesium 500 milligram. Or you can take infusion, what we doing also, like healthy vitamin minerals infusion, glutathione. In my office, I have the nurse practitioner. She's doing that in my office with a very good result. So you have instead taking daily, because when you're taking daily, not 100% is absorbed, but when you're taking infusion, that goes straight to the bloodstream. Yes, so it's different and faster results.
What about food intake? I heard before that getting your vitamins and minerals from food is the best. is there enough vitamins and minerals from food to sustain the body?
If you're healthy and you have as a child and you're taking a proper balanced diet between vegetable proteins, meat, vegetable, fruits, and you have balanced diet and you don't have any health issue, it will be enough. But nowadays, even that's why people start taking supplements, because you have specific amount of daily as a prevention or as a treatment, depends what's going on. That's why you're taking multivitamins, or you're taking separate single minerals or single vitamins with the higher doses, depends what's going on and what deficiency you have. That's also important if you take organic food or not organic food, if what soil it is, because what was 100 years ago in a soil and what is now, so not always the carrot what you have daily needs to cover in your body. So this is important. That's why I advise people on the springtime doing like a juicing, like red beet, celery root, apple, carrot, do 30 days juicing, and that helps you to clean the liver, kidney, also balance your intestine, giving you the vitamins and detox as well. And beets helping with to increase the iron, and that's general healthy, and you feel better clarity, you feel light. But when you have all this feel in the morning sluggish, takes you 2 hours to be yourself, then you take one coffee, another coffee, and it really is not good for you. So better start the day with the drink of the vitamin solution or vitamin B group, which give you the energy, resveratrol, and then you feel better, because this is like a trick with the caffeine. You drink the coffee and then you have like the boost for a couple of minutes, and then you feel more sluggish, and then you need another, and that create the addiction.
Mm-hmm. What about energy drinks? How harmful are those to the body?
The energy you're talking about, like Red Bull,
Monsters, Rockstar, all those.
Uh-huh. So people taking all these energy drinks, which there are also natural energy drinks, and with the vitamins, and not taking other like increasing energy like Red Bull, because also if you don't have some problem with the heart, that can create heart palpitations. So you have to be very careful. I'm not into the energy drink. I never drink those energy drinks, but I'm drinking my vitamin B group in the morning, Activized, German company from Fitline, and taking my collagen, like the great company Moddeer, which they have liquid collagen with hyaluronic acid. Sometimes you have collagen in a powder, but there is no hyaluronic acid, but really you have to have hyaluronic acid, which is like a base for the water, and collagen to take from along the bloodstream to your cell level. So it's also important in any supplements absorption, and how much is absorbed, how much is getting out from the body, and distribution in the body, and if the gates open up on a cell level and yourself got the fuel what you need. That's very important.
This is WZRD Chicago 88.3 FM, and we have with us at WZRD Dr. Violette Kolcan. She is a holistic medicine clinician. How did you start with acupuncture? Were you having like your back problems and your headaches, your migraines? Were you trying everything else and it didn't work, and then you had to resort to acupuncture?
I always was curious how it works, and when I deliver baby doing C-section, and I always cooperate, or hysterectomy, I cooperate with anesthesiologists, and I thought the acupuncture is the closest with the pain management, and I always encourage my friends anesthesiologists to put our patient to sleep before we do surgery. You should to go and do the specialization with in acupuncture. There's like pain management. You can help a lot different way, like people doing in dentistry instead anesthesia, they're doing acupuncture and for pain management and increase natural painkiller production in the body, and you can really after the session don't feel a pain at all. That is very interesting how it works. And the beginning of acupuncture was 3000 BC in China, when the Chinese emperor first was very popular herbology. So they make all this mixture with special superfood and mushrooms, lingji, fuling, reishi mushroom, which are like are called immortality, in giving our immortality, and they live a long life and healthy life. And then was acupuncture. Really, acupuncture start like with the prisoner. So they tortured the prisoner back in China, and they use like at the beginning said they have stainless steel needle or gold needle. So they use like or sharp stones in a form of needle. They use the pine cone. And then they torture different way, and they notice somebody who has acid reflux or ulceration in the stomach, and then after all this torture every day, they were healed. So it's really not like to be proud of the beginning of acupuncture, but then how they start making study and discover the energy flow, 12 meridians in the body, and there are parallel meridians. So there is like energy flow through the meridians, the same like you have central nervous system and peripheral nervous system. So you have like a spine and a brain, central nervous system, and you have 31 pairs of spinal nerve, which going on different level to the body, to the arms, to chest, to your abdominal cavity or lower extremity. And this is how you can stimulate different way with the acupuncture. You can help with sport injury. You can do pre-workout, after workout acupuncture to increase muscle endurance and prevent the muscle spasm, prevent any injuries, and increase blood flow. You can work on your digestive system, fertility, because that's my previous gynecology, and now what I'm doing, acupuncture, I combine both, so you can have the very good result with the acupuncture and infertility. Last year, I have like a 60 couple having become pregnant with the acupuncture after 10 years of suffering infertility, and 3 failed in vitro. So I think there are good results. And many areas after stroke, I have good results. People with TMJ, facial nerve paralysis, in many diseases, you can help a certain way, but it's not only what I'm using. I'm using cupping therapy, like detox the body, frequency therapy, because nowadays people are exposed of the electromagnetic pollution. Sometimes you're working in the area when are the antennas, towers, 5G towers, you're using microwave, you have you are a businessman and have 5 cell phones next to you, so which is not healthy, and people are irritable and they're changing, they start to be sick and low energy. So many modalities are very helpful, and the same in a female life, different stages. And I would like to invite people for upcoming big event this coming Saturday, Sunday. Is Healthy Living Expo in Schaumburg, and at 1939 North Meacham Rd, Schaumburg, at Embassy Suite by Hilton. And we have a few speakers for Thursday on 13 and 14. That will be Dr. Peter Kozlowski will be talking about aging gracefully and heart health, and also Dr. Payune will be talking about anti-aging and how delayed all processes of aging, about the collagen, hyaluronic acid. Myself, I have on Saturday at 3 p.m. at Embassy Suite by Hilton, 1939 North Meacham Rd, Schaumburg. Myself, very interesting lecture about the female balance, hormonal balance through all life stages, from childhood, teenage time, puberty, to your reproductive time, and premenopause, menopause, and old age. So welcome everybody. The entrance is free. We have many speakers and very interesting, and also you can come, and entrance is free. We have 52 vendors. So for last year was very successful. We have like over 2,000 people.
2,000 people last year?
Yes. Yes.
Same venue, right?
Yes. Yes.
Do you have that on a link? If you could send me the link later, and when we publish the video for this interview, I could include the link in the description of the video.
Yes. Yes. I will send you the link to the video when you have all address and all program for 2 days on April 13 and 14. If somebody want to have more information, I can give you my phone number and the link, and they can have a question. That always can welcome to call or check the link.
Yes, we'll make sure that you give us your phone number and contact information, any other contact information at the end of the interview. I also, do you have time for me to ask you a couple more questions?
Absolutely.
Okay. When you let's see, when you spoke about the meridians and all those different layers of the nerves that they understand about how to manipulate to stop the pain and everything else. Is there still more research going on right now to understand it even more, or do they already have the nervous system all understood already for the acupuncture?
So talking about the nervous system itself in a Western medicine, just out of connection with the acupuncture. So the scientists, know more and more than they know 100 years ago, 200 years ago, but still the brain is unknown. We only know like 6% of our brain, 94 not. If we know that telepathy, then we know how to do and how to program ourselves. So, and acupuncture is now more research about the acupuncture, how it works, because sometimes people, how does it work? Because people like to have like a proof, how does it work? So there is many research right now, and then we can do MRI before and after, how the brain function, and result before and after. Sometimes you can see immediate result because the high level of anti-inflammatory substances, and people get up from the bed after acupuncture, they see, oh, now I feel I have no pain. Absolutely. I was waiting 3 days for the pain. So it depends. It is not like you can give person the gold pill and find a solution for all your problems. If you're working on your unhealthy life for 30 years, don't expect that everything will be solved in one time. But recurrent visit and having the treatment and increase your health and detox the body, and you changing your nutrition, your diet, you're doing exercises, positive thinking, breathing exercises, what I will also teach on my lecture. So everybody welcome, female and male. So that are very important, how you can calm down, but at the same time, and also be productive and focus. And so then we have 12 meridians. So meridians is like an energy path through the body. The same like you have blood system. So you have vein and you have arteries. But you have also lymphatic nervous system. So what is the difference between blood system and lymphatic nervous system? Blood system has all white blood cells, but also red blood cells. In a lymphatic system, you have everything except red blood cells. That's why the lymph, when you cut the lymph, is white. And there are also only white blood cells and lymphatic system responsible for immune system. And the red blood system and red blood cells also for body oxygenation. So red blood cells with the hemoglobin, there are like a carrier, like a bus or taxi for the iron, hemoglobin, and bring on a cell level. So this is very important. And so that you can do like a MRI before and after. There are many research right now. And it's the oldest medicine. The Western medicine, it was like very poor in the dark ages and slowly start coming. And like first dentist, who was the first dentist that were like the smith, which just have all these tools for take care of the horses so they can pull out the teeth. So and then gradually that increased and they changed, like the same like blood groups that were discovered in 20th century, so not long time ago. So before even they don't know if they do transfusion, people die because they mix the blood groups. So many stuff is recently discovered and last 100 years in big progress, but couple of centuries before was very slow. So acupuncture was very advanced and is still now is the oldest medicine and very helpful. And nowadays even insurance cover acupuncture, not all of them, but in general most of them.
Do you know if Medicare, Medicaid, do they cover acupuncture?
They working on it on a certain medical codes, yes, but not all medical codes. Depends what problem you have and what also your insurance coverage. So for example, if you have Blue Cross Blue Shield, not always is covered for the same for different people. Depends on your coverage you have. So you have check with your provider how does it work. But nowadays acupuncture is also used in palliative medicine and also in hospitium. In hospital there is integrative medicine, when a functional medicine doctor, the holistic medicine doctor, the acupuncture doctor combine together with psychologists and working on a case, like in a cancer patient. Or there is a lot of side effects in chemotherapy, and those side effects are not like nausea, vomiting, and acupuncture is fantastic for that. And also there are points for production of the blood cells. So people with chemotherapy have tendency to have anemia, yes, or blood transfusion, because the chemotherapy or radiation not recognize, this is good cells, this is bad cells, kill everything, yes. So there are side effects. It's helpful with the cancer, but also there are side effects. And then we can cure with other modalities like acupuncture, herbology, nutrition, anti-inflammatory diet.
Could acupuncture stimulate more blood production so that there's less anemia?
Yes, there are special cells also for the bone marrow and blood cells production.
And you spoke about people wanting that just pay for a cure. If people abuse their body and then they ask for a cure like acupuncture or any special treatment, it might work, but if they don't change their lifestyle, it's not going to work. They're going to need that treatment all over again because they're destroying their body with the abuse, right?
Absolutely. You are so to pleasure to talk to. You're just so interesting in the body, and it is important to have a right person to interview. Yes, absolutely. Yes, that's the first what I'm saying. If you hear, that means you are ready for the changes. And I also say, I promise we'll change a lot of stuff, diminish all symptoms of your disease, reverse your age, changing everything, and there is big hope for the changes. But if you're ready to implement everything what I will tell you in your daily routine, if you stop smoking, if you stop drinking alcohol, you stop taking drugs, if you have problem with that, there is also the solution. There are special acupuncture point, and we can do regular acupuncture with the needle. Also using laser acupuncture for the people who have needle phobia. And I don't understand why people scared of acupuncture in that thing, like sterile, like floss, like hair. You don't feel almost insertion. You just feel some sensation during the session, some warmth, some tingling. But you have tattoo and you're not scared, but you're scared to help yourself. The acupuncture. So I always telling people there is hard work for both of us. But if you will to help yourself, not me, yourself, then we spend the time and we'll work together. There is a common job. And people have realized that you have to help yourself on a daily basis. People sometimes lazy. I'm coming late home. I cannot stretch my body, and they have so much stiffness, and that create degeneration, bad diet. But not I throwing on a patient the first day. Slowly, I'm changing. I think, he's willing to do this, but not ready for this. So let's start with simple way every day, and be consistent. What you're doing. If you're not ready for like full losing weight program, but you're ready for taking juicing and some supplements to detox first the body, we're working with this, then we're going on next step. If you gain the weight for your 30 years and you are 50 pounds overweight, you don't want to lose in 3 weeks. You want to do gradual, because if you lose in a short term so much weight, and fat tissue is like tissue which accumulate a lot of toxins. So if you have those toxins in the body released right away, they can go in different parts, like for example to breast, and create a breast cancer. So you have to do very slowly, gradually, and be happy with the result. And you're going in progress. You're not doing everything once and then you come back to bad habits. But when you learn to do it, like people sometimes listen, you have a lot of inflammation in the body and you have chronic condition. You want to help yourself. So no alcohol. Alcohol giving you a lot of inflammation and swelling in the joints, and then you have pain, and the same with the sweets, and there is the big factor of inflammation. So you have avoid dairy product if you want, except the eggs are good, have lecithin, good for the brain. But all milk product, we as adults and humans, we figure it out. There is good source of calcium. That's why we're drinking milk. But milk really is digested up to 1.5 to maximum 2-year-old digest. So we have. So then the rest of the ingredients in milk that are making fermentation in the body, and also making swelling and inflammation, especially like digestive system, IBS. The milk is not good. The cow milk, or if you want the milk in your coffee, you can use like almond milk, like from plants, the milk.
Is there a difference between a regular milk and organic milk?
There is difference because they use the cow. There are grass fed, and so all process is from not only the production of the milk and how it is, but it is like since how the cow is, fed by the grass and in a normal environment.
What I meant was that is there a difference? There are harmful ingredients in milk. You mentioned so. In organic milk, are the same harmful ingredients also?
So organic milk. If you don't have the inflammation, people drink organic milk. But if you have inflammation, no milk at all. So no cow milk, no goat milk, because that makes inflammation. But if you want to supplement the calcium, there is the different calcium like from the sea calcium, yes, from seashell, from the eggshell. Even you can wash and dry eggshell at home and dry it in the oven and then make the powder and 1 tablespoon every day. And you have calcium supplements. But you need only calcium, not although other ingredients would cause the inflammation. So, and especially people with IBS, irritable bowel syndrome, they notice a big difference when they stop drinking the milk, not only like lactose free, because not only lactose, the other stuff. So it's also important. And nowadays milk, even though it's different, I'm very often going to Michigan with my children and you see this is the whole milk from Amish milk. You see we can do butter, we can do kefir, we can do buttermilk and many other stuff. And this is the whole milk, and now this is like almost water in the store.
So it tastes better, but still, if you have inflammation, don't even drink Amish milk.
Yeah. So avoid the milk.
Yes. When you let's see, when you mentioned the juicing, let's talk about another drink. For when you are on a juice diet, does that mean you drink predominantly juice and then you still have other foods, but in moderation, or is it just totally juice, and for how long?
So I like the 30 days juice program. So you drink it. The best is the morning time. Drink your juice. So you're doing red beets, celery root, apple, carrot. So beets, as I said, has a good source of iron, cleansing your liver, support and detox the liver. A carrot, good for vision, vitamin A, and also antioxidants. And then apple as fibers, source of fibers, and the celery root. If you don't have celery root, you can use the bulk, the green part, but the white part is more diuretic, so you can cleanse your kidney better. So kidney are the filter for the body, so you want better filtration, take care of the kidney, so that will be good. You can also add dandelion, and dandelion also support the liver if people have a liver cirrhosis, liver problem, or dandelion helps the liver. Also women in menopause, dandelion is good because all metabolism of liver of hormones happening in liver. So like sometimes people saying, I'm not eating anything which include cholesterol chain, but female male reproductive hormones, testosterone, estrogen, progesterone, they are based on the chain of cholesterol. So there are other parts added to cholesterol and it turned to be testosterone or turned to be progesterone or estrogen. So I will be talking on my lecture at this Health Expo on Schaumburg this coming Saturday, and more detailed information. And when you have projector and you have all this chain reaction and showing how it's changed, so diet balance in diet is very, very, very important. Not that I'm doing only no sugar diet, I'm doing no fat diet, because also fat is important. Our brain is mainly fat. For thinking, you need the fat. For thinking, omega-3, omega-6, omega-9, you need fish oil from the fish. And also, this is important, this is good fuel for our neurons, our nervous system, our axons, dendrites, and our thinking, our processes, our cognitive part. And this is important for the brain, but there are healthy fats, and we'll talk about everything, and we cover myself and other speakers on this interesting free entrance expo.
When you spoke about your mentors, were you speaking about your Western medicine mentors or your holistic mentors? Let's just add a little bit to that too. What do your Western mentors say about holistic medicine?
So the biggest mentor for all doctors, Hippocrates, I think. So didn't have a chance to see him, but read everything about our approach. And even lately, I was with my group of friends because I was leading a Reiki classes in my office for a group of people who are interested in spiritual, emotional improvement, who won't be the Reiki practitioner. So it is like energy healing for your all chakras and for your meridians, and some people generally are born with this ability to heal, distance healing, or you are be present. So I was teaching about that, but then I opened Facebook. I don't like Facebook at all, but it's good. But I tend not to close because I always, can inform people about what's happening in the city, and very healthy seminar, not only mine, but the other providers. So I like to share this and support women, men, and everybody. But I also leading these classes, Reiki classes. And in a Facebook, I found, International Surgical Museum on a Lakeshore Drive. Just like North Avenue, Lakeshore Drive. I'm Polish, so it's not next to Polish consulate. So I always was in consulate, but never then. And then like a few years ago, we have like a physician ball. And then we have a few doctors, speaker were there. So that was my first time a few years ago. And now I see Surgical Museum. They have a Reiki classes and a gong class.
Qigong, you mean?
Tibetan gong, like, the ball. The ball sound. The sound healed the body.
Yes.
Yeah. So our heartbeat is a sound too, vibration. Yes. When the baby is born and is screaming, and you put on the chest, why calm down? Because what here, 9 months in a utero, boom, 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 boom. This is what heals, yes? This is what heals. You put on the chest and the baby calm down and stop crying. So, and any vibration, and you can even listen different vibration for your brain, for meditation vibration.
What about cat purring? I've read that the cat purring is they really don't understand where it's coming from, the cat, but it definitely does some healing.
Yes, cats are very interesting animals. And I have one patient, he came to me and said, I don't know what's happened. My cat become crazy, and he always is calm and sitting last month on my side, like under the chest cavity, like a borderline with abdominal cavity, like your diaphragm, all right, and screaming and scratching and screaming and scratching. And I show him, and he has all scratches here. And I, evaluate, diagnose. We didn't do yet laboratory screening, but my intuitive part and also my healer part in me, not only as a doctor, and also like a Reiki practitioner, I told him, you're going to hepatologist right away. And really had a liver cirrhosis. So that is interesting how it works. Yes, so we have Be Open Monday on many sign in the world, and just coming back to this sound healing, and so we're going then and doing this lying on the floor, and it was nice. Like, oh, my friend doctor, we have this Reiki practitioner teaching us how to do, and there's the sound bowl meditation. So I was lying down on my mat, and there are like beautiful postament of the around the old wall of the all fathers of medicine, like Avicenna, Hippocrates, Röntgen, all these big medicine doctors, father of medicine. So I just lying down, and I opened my eye and I say, oh, Hippocrates is above me. I even didn't notice. So just coming to who is your mentor, and the same like in a high school, even I have good math teacher, and I always like very high demand professors and teachers. If they are very high demand and also have ability to teach, that's why I like teaching, and I learn a lot how to teach and make classes interesting. Not like reading the book is boring, you can read at home, but I'm giving a lot of samples, how to use in daily routine, how to practice and make more interesting. So, I was teaching also it's a medical school, and our students, they never make notes. They put the video recording, and how they learn, like, recording my speech, because that stays in your head, and I'm giving the leads how to quickly and long-term memorize. So coming back to this International Surgical Museum was a nice experience, and you have to open up and give away this tightness in the body and let it fall. I'm like multitasking person, doing many stuff and running here, there, have a classes, have my clinic, office, and radio station, and running all over. But sometimes myself, I teach everybody, and I'm teaching myself. Slow down. Our brain is like computer, so believe me, you have slow down to reset your brain. Just do nothing. If you don't know what to do, do nothing. Do nothing, just relax, and trust the universe. That's always what I'm teaching. The people who always has a problem with worries, like worry day before even did happen, or judging before anything happened. So just trust the universe, and the path will go on right place. And I always asking them, do you like drive in the nighttime? Like you're going, to Canada, and there is almost trees and nothing else, and you have like 3 lines on the one side, north and south, and you driving. Do you speed? Just tell me honestly. Do you speed? I speed. I shouldn't tell on the air. But you're speeding because you feel this air, freedom, and you go. But I asking, have you ever think, if you that worry, oh, what will be tomorrow when I awake? Oh, my son going to the school, or going here, or the university, what's happened to my kid, or this married right person or not, will be this. And why are you going ahead? Don't worry, trust the universe, and trust the universe and everything coming good to you. Don't attract anything negative. And I think when you're just coming back to this highway, in the nighttime you're speeding. And have you ever think about that? I cannot speed. I have go slow, because what's happened in a 1 kilometer, 1 mile, I'm going to the cliff and I just collapse and die in a car accident. No, there's not such thing like, the cliff suddenly with no warning. And I think everything can happen, earthquake, unexpected something. Everything can happen. So you worry about it? The same with life. Don't worry. Trust the universe, practice meditation, deep breathing technique, especially women, because men naturally breathe with diaphragm and deeply. And women like shallow, so you don't have good oxygenation. So that's why we have slow down processes. That's why God so smart, figure it out. We have sleep, we have day and night, otherwise we'll have day all the time. And welcome everybody to the solar eclipse, yes? It's perfect day, astrological, good time for us, for this perfect energy and great person in radio. Thank you, Trudy, for inviting. So trust the universe and calm and be calm and focus what is important and eliminate from your life what is non-essential. So focus what is right. If something not serving to you, just eliminate. I was strongly believer in the past, like my parents, when you start project, you have to finish project. That means you are successful. And success is also failing. If you fail it, because when you become very successful and you in this comfort zone, you're not making anymore. You're just successful, yes, and you are in this comfort zone. But sometimes it's good to get out from the comfort zone box, yes, and make changes. And don't be afraid. Make changes. It helpful and be open on something new. Don't stay in comfort zone. Don't stay because it's familiar. Don't stay in abusive relation. Don't stay in a job when you don't like. Even you can lose this job and you worry you cannot find the other. What always is a new solution, always new job waiting for you. Don't make discomfort to your mental, spiritual, and body health, because it's big impact. If you're living this poison every day, poisoning people, energy vampire around you, and plus you have too many projects, too much carry. Listen, we are, our body is like computer, but help the body to survive difficult time, and don't put yourself in a bad spot, bad situation.
Earlier you mentioned grief affecting the lungs. Is it that people, when they're grieving, they don't breathe right and then they hurt their lungs?
It's good question and answer. Yes, this is also the question and the answer. And we have like 7 chakras. What is the chakras? Chakras are like energy station. Like we can combine to the train, yes? Train going from station to station. And along there are tracks. So station, there are our chakras, chakras, the combination of sources of bundle of nerves. Like for example, here below the diaphragm, like a diaphragm level, in the middle part of the chest, below the chest, you have solar plexus. And it's interesting. Western medicine don't recognize any chakras and don't believe in chakras. But reading medical book, you're talking only about solar plexus. Everybody knows what is solar plexus, yes? Because all nerves coming from the lumbar area, below the chest, to the front, surrounding, and this is a bundle of nerves. So martial arts, they're talking about solar plexus. Like you hit somebody in solar plexus, even collapse, yes? Or sometimes when you feel like you're gonna collapse, you eat something wrong, you have poison, you feel like weak from the stomach and you feel like wet, sweating, and you can collapse. So we have solar plexus, which is recognized by Western medicine, but we have also head chakras, so crown chakra, which is like blue and connection with our surroundings, the heaven, we're saying, the sky, the universe, and it's bluish, darker bluish. Then we have third eye chakra between the eyebrow is our, so crown chakra is conscious, this is subconscious. And even people have a problem with sleeping, you can have any lavender oil on some essential oil on the tip of your finger and glide here between the eyebrow, and easier to fall asleep and calming. And there is also acupuncture point for that. There is throat chakra, which is light bluish and also responsible for your speak up. For sometimes people that are in relation cannot even open up, And even like in a childhood, parents, sometimes there are very tough parents and kids have no rights to talk, yes? And you're holding this all your life. And then suddenly people have vocal cords problem. People have nodules on vocal cords. People have thyroid problem.
Throat cancer?
Can have it. So throat. And there is heart chakra, which is like a green color, and all green crystals can help you too. So related to emotions. Solar plexus is the color yellow. Then you have a navel chakra, which is orange color. I am today navel. You too.
Yes.
Red. You are sacral. You are a sacral chakra, which is our, like we call it, kundalini. And in the front is like on a pubic level, in the back in a sacral level. So that is interesting. So we have chakras and we have meridians. And meridian, so chakra is like bundle of the nerve system, bundle of nerves, and our meridians, there are like passageways from the central nervous system to the all receptors, all the surface to the all the way to the skin.
Like the chakras are like the train stations, and the meridians are like the major tracks.
Thank you. You're really listening me. That's what I want to say. I start and not finish, but I have good partner in dialogue.
Thank you. You've got so much useful and interesting information, Violette.
Thank you, Trudy. That is so pleasure to talk to you. I have invited you for some good healthy drink. Juicing, red beet, celery root, apple, carrot.
Okay. And celery root is actually from the celery plant, right?
Yes. So like you have potato, yes? So it is in the ground, and then you have the green part. So this is what it is.
Well, Dr. Violette Kolcan, thank you so much for joining us at WZRD Chicago 88.3 FM today. And I think that we have just barely touched the surface. We should be having you back again in the future to talk some more with us.
Thank you so much, Trudy.
However, again, tell us about how to contact you if our listeners want more information. Repeat the information about the conference, and also one more question: does the conference contain the sound healing as well? Anything about the sound healing?
Yes, we have the vendors which also provide the sound healing, and you can have a mini session and invite everybody. That will be like discounted prices and many stuff for free. There are raffles. You can also win the trip to Europe, a bag. That is also, I gave also the raffles to my clinic, and you can win the acupuncture, relaxation acupuncture, acupuncture facelift, and laser treatment. So everybody welcome. Every guest will get, and every attendant person get the raffle, and you have a chance to win. There are many speakers interesting about anti-aging, collagen, our joint health, our body health, hormonal health, and thyroid. And you can meet our vendors, you can meet the doctors, and you have some conversation with them, and some initial evaluation, and then some mini tests are available. So 2 days, 13 and 14, 1939 North Meacham Rd, Embassy Suite by Hilton. If anybody want to call me or leave me the message when I still in radio, you can leave me your phone number. I call you back, 773-562-0734. 773-562-0734. The link to our expo, I will leave the Trudy, and she will leave the link under this Zoom.
Okay, under the YouTube video.
YouTube.
Yes. And it is in Skokie, right?
Yes.
Okay. Thank you so much, Dr. Violette. And thank you so much for all the information.
Thank you, everybody, and see you soon.